Is the Y-lift worth it? According to the Y-lift website, Dr. Jan Trokel developed a non-surgical, minimally invasive procedure that requires no incisions, stitches, or general anesthesia. Dr. Trokel uses a specialized titanium instrument, which is inserted beneath the skin and then maneuvered throughout designated parts of the facial region to instantly lift the muscles, fascia, and fat underlying the skin. Once lifted, hyaluronic acid, a substance which is naturally present in the skin, is used to hold the newly elevated position in place, at which point the titanium tube is removed from the treatment site. The rejuvenated face is then sculpted to accent and highlight each individual's beauty.
Thank you for your question. You're asking a very simple question. You're asking, is the Y-lift worth it? Well, I can certainly help you with that question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculoplastic surgeon, oculofacial plastic surgery, practicing in Manhattan and Long Island for over 20 years. And I was the first surgeon to be trained by the inventor of the Y-lift, and have been very happily integrated the Y-lift into my practice of cosmetic facial rejuvenation. In the body of your question, you basically brought some information in from some public information about what the Y-lift is. But I could certainly understand questioning whether or not it's worth it. It's, as somebody myself, I'm also very innovative in my practice. I understand what it's like to do something differently than other people, and it raises questions about the legitimacy and the value of such a procedure. So to help you understand whether or not it's worth it for you, let's learn more about the specifics of the Y-lift so that you can answer for yourself if it is worth it. First of all, the Y-lift or any facial rejuvenation procedure is aimed to deal with one or both of the changes that occur with facial aging. Number one is volume loss. As we get older, we lose bone, muscle, fat, soft tissue. Two is sagging. The skin sags, the support of the skin sags as well. The SMAS, the superficial musculoaponeurotic system. So when we think about lifting, for a surgeon, lifting means vertical lifting. When I do a surgical facelift, I'm restoring definition of the angle of the jawline, the cheeks, etc. So that person who's lost that definition looks younger because now they have definition. That's what a youthful face is. With traditional use of fillers, it is limited, and typically by dermatologists or non-surgeons, to the superficial levels of the skin, such as the dermis, or I should say deeper level of the skin, the dermis, or below the skin. With Y-lift, what we're doing is we're actually using long-lasting hyaluronic acid fillers, such as Juvederm and Voluma, at the deepest level of the face, at the level of the bone, below the muscles. And their method is so elegant and so efficient that we can actually place a fair amount of material to restore definition of the cheeks, the vertical aspect of the jaw, the jawline, and the chin in terms of projection. We can also augment the temples. We can do a lot with this method to enhance the structure of the face and restore definition. This is why there's so much skepticism by patients and by colleagues, other physicians and surgeons. When they see these results, they think there's some type of deceptive practice or some type of something that these procedures are facelifts that are being represented as something with filler, but that's absolutely not true. I perform this procedure routinely we are doing a lot, and the person can actually look younger and look thinner in terms of structure by creating structure. That's in sharp contrast to traditional filler application, so that if you put 2 to 4 syringes in someone's face and it gets heavy, the skin will sag. When you're placing the filler deeper, this is where someone with a surgical background who does cosmetic surgery, facial plastic surgery, does facelifting, cheek implants, chin implants, the surgeon actually has worked in this space and understands it very well. For me, it was a very natural evolution to learn this technique using filler in an artistic way to restore structure. I think it's very much worth it. You know, there's a certain sweet spot which this procedure fills. For the person who doesn't have enough skin to justify a lifting procedure, surgery, but wants to develop more angularity, this is a fantastic procedure. This can be for women in their 40s, men, as well as anybody in their 60s, depending on their facial structure. So the fact that it also can last 2 years or more is also makes it a very good investment. And in terms of the overall plan, we do see our patients so that we can maybe add a little bit if necessary, because we can't say everybody it'll last exactly the same amount. But it does fill a very important void in the world between traditional use of fillers and surgical procedures such as facelifting and neck lifting. So I think that Y-lift is very much worth it, but you have to see if it's right for you. Meet with a qualified Y-lift provider, someone who has been trained to perform the Y-lift and who does the Y-lift in their practice, and see if this is the right solution for you. I always tell my patients who come in for consultation that they don't necessarily have to have the whole procedure, because if they do have certain elements that are still good, then, for example, we can just augment the cheeks and get this and use this Y-lift method without using the large volume of syringes. It's all about customization and artistry. It's not a cookie cutter procedure, but the concept, the method is very, very specific. It requires very specific training and experience to do it in the way that the inventor performs it himself. So I hope that was helpful. I wish you the best of luck. Thank you for your question.